So it is a real pleasure to introduce our next keynote speaker, Deputy Secretary Andrea Palm. And in this role, she serves as the Chief Operating Officer overseeing the day-to-day operations at HHS. She is a long-standing leader in state and federal government, and most recently served as the Secretary Designee for the Wisconsin Department of Health Services, which is actually one of the largest agencies in the state and includes public health. And there she was responsible for a multitude of programs, Medicaid, SNAP, behavioral health, among others, and led the state's COVID-19 pandemic response. And she's held a number of policy and operational roles during an 8-year tenure during the Obama-Biden administration, working on the Affordable Care Act and worked to combat the opioid epidemic. I saw in your bio that you were born and raised in rural upstate New York, so between there and Wisconsin, you're not afraid of the cold, which is pretty cool. But of note, I wanted to make mention to the group that she leads the coordination across all the interop efforts through HHS that Mickey talked about yesterday. So she is really the lead for so much of what we've been talking about. So welcome, Deputy Secretary Palm.
Thank you so much. It's a pleasure to be with you all. And with the cold comes a long and deep love for hockey. So I don't know how many other hockey fans are among you out there in California, but I'd be happy to chat about that at another occasion. But I'm very happy to be with you all today. As noted, I know you all heard from Mickey yesterday. I just want, as a colleague of Mickey's and a fellow leader here at HHS, really express my appreciation for his leadership, for the way in which he and ONC are leaning into this work, continuing to push it forward. And he literally, time and time again, steps up as I ask him to do more and different things to help us move the system forward. So my sincere appreciation to Mickey, who really is a tremendous colleague and leader in this space. As was noted, I am the Deputy Secretary at HHS, and as such really do have a unique perspective on really what are the underpinnings, the foundation, the enablers of the work that we do more broadly here at HHS to serve the American people, to help improve their health and well-being, and the work that is happening across the healthcare sector is foundational to how we think about the ways in which we interface, the ways in which we integrate ourselves into the work that's happening across the board. And I'm just going to highlight a couple of things, if I might. Here in the Biden-Harris administration, we really have made lowering healthcare costs and improving quality and safety in care a top priority for all American families. And for that to be possible, the way in which we think about healthcare needs to continue to evolve, mature, and improve. And we, as you all know better than anybody, we really do need a 21st century digital healthcare system that benefits patients, that supports providers and healthcare companies, and really most importantly, allows for everybody to connect safely, efficiently, in a way that allows for the sharing of information, again, to promote the health and well-being of the patient and that family. And part of what really defines, in my view, a 21st century digital healthcare system is interoperability. I feel like it's a word we've been talking about for a very long time, and to be able to be part of the progress that we are making, that we continue to make, and that we still need to make is a personal privilege and point of satisfaction for me. So again, my appreciation for allowing me to be with you and to be a part of this larger community of work. Again, sort of coming back to the ways in which HHS uses its levers and needs to use its levers, we really are committed to thinking about and lifting up and looking across our enterprise and bringing to bear all of the opportunities that we have to facilitate a 21st century digital healthcare system. And part of that really is TEFCA and the ways in which you all have been helping us leverage that network to address, a variety of use cases that are going to tee us up to move this forward. So I would really like to thank and commend the Sequoia Project and all the folks who are Qualified Health Information Network candidates for the hard work that you all have been doing to prepare TEFCA to be ready to go live by the end of the year. It's really, we're at an exciting moment here that I know we've all long been pushing for and waiting for, and it's really nice to see that we're just about ready to flip the switch. And so there are, in addition to that, right, there are many other exciting and important things that are happening at the department right now to complement that, again, to think about using all of our levers to bring to bear on this concept of a modern 21st century digital healthcare system. I know Mickey provided specifically updates on the ONC pieces of this, so I'll let those rest, and I will focus on a couple other examples just to highlight. We have been thinking a lot as we look to put the people that we serve at the center of what we do, how their experience as customers of the variety of programs that we have feels, what the customer experience is like, and improving the delivery of critical benefits and services is an important way in which we think about and can do that work better. So we know from the public health emergency and its unwinding that we have this opportunity to leverage the renewal process, the process by which all of our Medicaid beneficiaries need to be determined still eligible for the program as a way to improve customer experience. And that involves working with states to make sure not only that people are getting their reminders and understand the process and know what to do with it, but it means using all the data that's available. How are we making a more seamless experience for Medicaid beneficiaries so that they're not having to refill out applications, they're not duplicating information that we already have sitting on a shelf somewhere? How are we pulling that into this process? Again, to think about the people that we serve, putting them at the center of what we do, being accurate with our eligibility determinations, but doing it in a way that is as seamless and as simplified and efficient for the customers that we serve. And that will pay benefits and dividends in the Medicaid program in the long term and provide lessons to us for ways in which we can do that work in other programs across HHS. So not only are we thinking about improving how people get and access benefits, we're going to continue to look again at ways in which we match and share and use data to make it easier across the variety of HHS family, the HHS family of programs to engage beneficiaries and make sure we are serving them in an exceptional way. We've also here at HHS over the last number of months been thinking and looking at our data more broadly. We are in the process of developing, to become public soon, a data strategy that while thinks, I guess, first about getting our own house in order, how are we sharing data within the HHS family, again, to ease the burden on our many customers as they interface with us. But I did want to share a couple of observations as we have done the work to pull this strategy together to think about how, again, we're going to put our shoulder against this question and move our work to the next level when it comes to data. And the first really is around data talent and our frankly, our resource constraints. We know we often cannot compete on salary with many of you in the private sector for the kinds of data expertise that we need. And so we are working to think creatively, to use new tools, to be able to recruit and retain the kind of data FTE that we need to allow us to up our game and really modernize the way we think about using and sharing data. The second is around sort of that natural tension around data sharing and data privacy. We know we can and should do more within the department to share data. We also know that we have constraints around what our authorities allow us to do statutorily, and how that works with states and again across the federal family. But we also need to execute against our mission. And so how we find those barriers, how we work our way through them, again, so that that data is able to be shared in ways that are more seamless, more efficient, that make more sense to our customers, is a really important part of how we're thinking about moving forward. The third really is around opportunity versus risk, particularly as it relates to advanced technologies, things like how we maximize the use of AI while minimizing the potential downsides. I think about equity when we think about this work. We know that a lot of our divisions, the family of HHS agencies, are already using AI. FDA is clearing medical devices that are AI enabled. NIH is investing large amounts of money in research in this space. We understand that we can make significant medical breakthroughs and improve health and well-being with this tool. But threading the needle on risk and risk mitigation is going to be a really important part of how we as HHS lead in this space to improve what we can deliver for the American public while maintaining the trust and the expectations that they have of us around this opportunity. Fourth, we really do need to think about how we accelerate progress on priority health-related initiatives. The president has set a very clear cancer objective for us. We also have significant work to do in the behavioral health space. It is a place where, when it comes to data technology, interoperability, we've got to do the work to bring them into the system so that, again, as we put people at the center of what we do, those pieces are no longer left behind. And so, again, while we are not yet quite public on our data strategy, it's a really important piece of business for us, a really important thing that we need to do, again, to think about how we continue to excel at delivering for the people that we serve. Next, if I could, I would move on to two other topics briefly. One, that I'm sure you are all familiar with, and that is information blocking. We continue to be committed to developing and implementing policies that really do discourage information blocking, to help people and their health providers that they allow to have access to their information, a level playing field that they need to do that work. Last month, we released a proposed rule for public comment to establish disincentives for healthcare providers found by our IG's office to have committed information blocking. But this is a complement, right, to work that has already been ongoing in our IG's office. They have a rule already that establishes info blocking penalties for other parts of the healthcare system. And we're confident that as we pull these pieces together, we will have created the kind of framework that we can update, continue to work in, that will provide what we need to make sure that we're doing the work in this space that allows for the appropriate flow and sharing of information across the system. The last thing I'd really like to spend a few minutes on is cybersecurity. It's a place where I personally spend a lot of my time. I recognize what a significant risk it is to the health and public health sector, and that we have a really important role to play in helping hospitals be more resilient and to recover when and if they are the victim of a cyber attack. Our data suggests that we've seen somewhere in the increase of about 300% in cyber attacks over the last 5 years. The problem is here, the problem is now. And again, when we think about trust, public trust, and our responsibility to the people that we serve, this is a place where HHS really is going to continue to lean in and work to help the sector become more resilient. We think about this as a patient safety issue. Ultimately, when things are offline, if you are needing to divert ambulances, if you have to cancel appointments, if you are in a particularly rural part of the country, what you need may not be available when you need it, and that again is a significant patient safety issue. And so for us, we're really trying, as the sector risk management agency for the healthcare sector, step into a role that is the front door, the way into all of the broad resources that the federal government has to offer, whether it's NIST or CISA or FBI on the law enforcement side for those who have been a victim of an attack. Maturing our one-stop shop for those kind of resources, for making it easier and simpler to navigate the federal government when something like this happens, as well as bringing to bear our expertise on resilience and response through, again, our SRMA function at our Assistant Secretary for Preparedness and Response is a really important part. And then how we think about assisting hospitals, again, particularly under-resourced hospitals, to raise their game on cyber so that their systems are as protected and up to snuff as they can be, considering how much this landscape is changing. So all of that together makes the world a complicated place, in which I am grateful to be partners with all of you as we think about a truly integrated, modern healthcare system that allows us to put the people at the center of what we do, that is worthy of their trust and expectations about how we do that work together, and allows us to continue to push forward on the improving the health and well-being of all Americans. Again, I really want to express my appreciation to Sequoia, to the folks, to the QHINs, and the folks that have done really hard work over the last number of months to get us to the precipice of going live in that space. I look forward to seeing many of you in December when we do that. And with that, again, my sincere appreciation. I'm sorry I couldn't be with you in person. Please enjoy the rest of your time together, and I will turn it back over to you. Thank you so much.
Thank you so much for joining us, Deputy Secretary Palm. It was just a pleasure to have you join us, and we look forward to seeing you in December. Bye.